Hello, everyone. I'm Destiny Murray.
And I'm Angela Kelley.
And we are going to talk to you all about early childhood transition from Part C to B. We're going to focus on the children who actually are going to transition to Part B, not those who qualify for Sooner Start and then did not qualify for school services or special ed within public schools. Okay, so let's go here. Alrighty, so Part B to C, Part C to B, I apologize, is a part of IDEA, and it requires that a child who qualifies for special services must transition into Part B services and have an IEP in place for school services. I want to stress that this should take place on or before the child's 3rd birthday. And here is a flow chart to explain that process. We start with the Transition Plan Conference, the TPC. This is a Sooner Start meeting. It can be held in a public school, but it is a Sooner Start meeting. From there, at the meeting, you can review the reads, or you can schedule another meeting to review the reads. And then from there, you get parent permission for evaluation if required. So if the team feels that more information, more testing is needed, the parent gives permission to evaluate the child. And from there, we have our comprehensive evaluation. And then we're going to send out a notification of meeting. And then we're going to have that MEEGS meeting where we discuss the findings from the qualified examiner. And then from there, we're going to have our IEP meeting, and we're going to send a written notice to parents. So at our transition planning meeting, the Sooner Start staff is going to facilitate that meeting, and they're going to share information about early intervention services previously provided. They're going to encourage family participation. I do want to reiterate that parent and family input is crucial for early childhood children because the parents spend the most time with those children, ideally, so their input is very valuable. And then we're going to learn about the LEA programs and services provided in those schools, and then we're going to summarize the next steps. So more on the TPC meeting. So at that meeting, you determine if the child is eligible for Part B services. If the team feels that the child qualifies for Part B services, then that is when you schedule the MEEGS meeting. And then from there, if additional information is needed, that's where you get the parent consent for testing signed. Parents are allowed to decline services before or after the TPC. So if the school tests the child and they do qualify for services, the parent can decline. That is their right. So if the team feels that the child needs to be tested and that they will qualify for Part B services based on the services they receive with Sooner Start, the school district has 45 school days to complete the evaluation. The exception is if the child's 3rd birthday comes before that. If, in fact, the child's 3rd birthday comes before that 45-day timeline, that IEP must be in place by the child on or before the child's 3rd birthday. Okay, we don't have any questions so far, so I will continue. So the comprehensive evaluation, that is where we're going to look at the whole child. So typically you will have the qualified examiner administer a battery of tests, and it will give an accurate picture of the child's overall present levels. And that can be found on page 76 of our Special Education Handbook. So a qualified examiner, that would be a school psychometrist, a school psychologist. You can also have the related services qualified examiners, the physical therapist or occupational therapist, but they have to be qualified to assess a child. So that does not include general ed teachers or special ed teachers or a parent liaison. They have to be a qualified examiner. So let's talk about the MEEGS, which is the Multidisciplinary Evaluation and Eligibility Group Summary. When all evaluations and data are complete and recorded on the MEEGS form, a meeting can be scheduled to determine eligibility of the student for special education and related services. So the purpose of that eligibility or MEECS meeting is to review and consider all evaluations, assessments, and data collected. And like I mentioned before, it will give an accurate overall picture of the student's present level. So all factors of the evaluation should be considered in the determination. Not just one piece of data should be used to determine if a child qualifies or not. We need multiple evaluations and assessments and data. So the group attendees at that MEECS or eligibility meeting are the parent. We put student if appropriate, but since you're going to be talking about 2 or 3-year-old children, it wouldn't really be appropriate. You would need a qualified examiner, service providers, so that could be your speech language providers, occupational therapists. You need the special education teacher. You need a general education teacher, an administrator, and persons invited by the parent and other qualified professionals as appropriate. That could be advocates. That could be additional people with expertise regarding that child. I do want to touch on the general education teacher. If the school district does not have that program, have a special ed program in place for 3-year-olds, and therefore they don't have a general ed teacher, it is okay to pull an early childhood teacher. You can have a kindergarten general ed teacher, or if you have a pre-K teacher, you can pull that general ed teacher into that eligibility meeting. And these are the 13 disability categories. I want Ms. Angela Kelley to tell you all about the disabilities that are sensory related.
Okay, so each school district every year has the ability to make the decision if they want to identify children for special education and related services either in a specific category, which we have right here, or in number 13 category, developmental delay. And if you are a developmental delay school, you are going to check all 5 of the domains that are required, and then you make the determination the child is a developmental delay. We have lots and lots of, we have a whole section in our handbook about the criteria for developmental delay, and use those as guidelines, please. And then you have to put a suspected disability, because that is how our funding is derived. And so you put developmental delay is their category, and they are suspected to have speech language, autism, whatever is the other major disability component. The only exception to this developmental delay process is a sensory impairment. If they have deafblind, deafness, hearing impaired number 5, what's the other one? Number 12, visual impairment. Those children are never placed in the category of developmental delay, okay? They are put in their individual sensory category.
Okay, thank you.
Mm-hmm.
Okay. So we've had the eligibility meeting, or the MEECS meeting, and we have determined that the student is eligible for special education services. The school district has, within 30 calendar days, to write an IEP for their child. At the eligibility meeting, the team can have the IEP. That is completely acceptable. We're going to reiterate again that the IEP must be in effect by the child's 3rd birthday. And then at the IEP meeting, it's the same members as at the MEECS meeting, except that the qualified examiner is not listed. However, that could be a team decision to have that qualified examiner stay for the IEP meeting. It's a team decision for that. And then when we have that IEP meeting, the special ed teacher and the team should consider the strengths and educational needs of the student, the results of the evaluation, the developmental, functional, and educational needs of the child, the parent concerns for enhancing the education of the child, and the provision of FAPE. I want to go back to parent concerns, especially for that initial IEP for our students transitioning from Part C to Part B. Get as much information from parents regarding their students' needs and strengths any norms, any trends they see with their students, well, with their children, or that they experience on a day-to-day basis. That way that the parents spend the most time with these children, so we have got to make sure that we are accurately and appropriately servicing our students. And the IEP will also address special factors, goals, progress towards goals, and accommodations, like any other IEP that's written for up until they graduate, if they still qualify. So our related services, this is just a short list, but of course we have occupational therapy, physical therapy, counseling. That could be parent counseling or not, well, parent counseling and training, social work services, speech language services, and transportation. If a child is going to require transportation, it has to be written into the IEP, and that is a related service. And then from there, let's talk about our least restrictive environment or our placement options for students who are transitioning to Part B. We have district pre-K programs, private pre-K programs, or kindergarten programs. These include faith-based or parochial schools. We have child care or child development, Head Start. We have group child development center and child care. I want to talk about a little bit more on this slide. So, what are regular early childhood programs? We listed most of them on the previous slide. Head Start, Miss Angela, who is currently the early childhood specialist, she is such a huge advocate for Head Start, and so am I. So if you have those Head Start programs, please develop a working relationship with them. They are so awesome for kids and their developmental growth. And if you all have any questions, this is our contact information. I know we only have 30 minutes for this, so if you have any questions, please reach out to us. Do you want to add anything?
No.
I, of course, want to add that the IEP has to be in place on or before the child's 3rd birthday, and on that services page, the begin date should be their birthday, even if their birthday falls on a weekend. All right. Thank you all for listening. We hope this has helped you all. Have a good day.